So let's talk about the materials. The materials are critically important. We've got different materials in doing and providing these services. You have surgical materials, which, if we get into the graft material, that's very important that the doctor knows what to use, how to use it, how to graft, how to regenerate the bone. But then also you have implant materials, the screws that go into the bone, and then you have the prosthetic materials. So there's a lot of different materials, and all of these connect to each other, and they all have to work in unison. And it's the graft material from the implant to the prosthesis. The doctor doing the procedure must be very acutely aware of what he's using and why he's using it, research-based, and looking at the data and understanding, and not based on cost. There are thousands of implants on the market, and if I were to choose an implant because it's a cheaper implant for me to buy, I'm not doing the patient any service whatsoever. I'm only looking after my own interests, and that doesn't work a lot of times. I'm going to show you why. So first we're going to look at the materials of the prosthesis. So this is actually an all-on-6. It's not even, so he has implants in the back of the upper jaw. But the materials is what I want to look at here, and the failure of the prosthesis, and how this is a hybrid, so it's got a titanium framework with denture teeth or plastic teeth. He bit down and the whole thing snapped off. And this wasn't that old. It wasn't very old. It wasn't like it was 10 years old. And so the materials matter. They matter a lot. And so that's why my suggestion is use zirconia. And we've had cases, very few, where the zirconia can fracture, but it's a much easier fix. You do have to replace the entire prosthesis, but we save the file that we've created for the patient, and we mill out a new zirconia prosthesis, put them back in their PMMA while the new one is being made. But that is very rare. It's not something we see a lot. Another situation, basically the exact same thing. However, this is an all-on-4, and no posterior support, no implants in the back of the jaw. All the load is in the front, and so of course, after about a year or so, prosthesis fails, and now she's kind of stuck because this has to either be remade. You could restack the resin or denture teeth, because these are denture teeth with plastic over a titanium bar, but the load factors are still unfavorable, and so it will just continue to break. Now let's look at a prosthesis that we would do here at Trust Implants, and just take a look. So this is an upper all-on-6. Look at how beautiful, aesthetic, strong, clean, hygienic. There's just no comparison to the two types of prosthetics. This is slightly more expensive, but what you're talking about is a procedure that is to be created and finished that will last you the rest of your life. And the reason I say that is because the materials used, bone graft materials to be used, implants materials to be used, prosthetic materials to be used, if done properly, it will last the rest of your life.